Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Karla Lester. She's a pediatrician and a certified life and weight coach. Today's KevinMD article is titled The Epidemic of Narcissistic Abuse in the Medical Field. Karla, welcome back to the show.
Thank you for having me. As usual, I appreciate the platform.
So Karla's been on multiple times. Go to kevinmd.com/podcast. Upper right-hand corner, there's a search bar. You can search for Karla's old episodes and hear her story. So today, let's jump right into this one, the epidemic of narcissistic abuse in the medical field. How did this particular article come together?
Well, I have a long history of advocacy, and I started a nonprofit in 2007 to address childhood obesity, started working with the Children's Hospital here in Nebraska to create a pediatric weight management clinic here in Lincoln, led that, then a population health center there. That was my vision, moved the assets of my nonprofit to Children's. And during that transition, as I was dissolving the nonprofit and it was moving to Children's, was an exciting time creating this vision for population health. The Affordable Care Act was out. At the same time, that's when the narcissist came out, crawled out of the shadows, and started to enact their actions and started moving into their stages of the narcissistic abuse pattern. And I really wasn't aware of that. There were signs along the way that I wish I would have had the perspective. And that's why I'm speaking out now. So 4 years ago, exactly, I resigned per my attorney's directive, leaving everything that I had created there and up to $500,000 of my nonprofit assets that I brought. And a lot of it was due to narcissistic abuse. And so as I've healed, worked with a coach, called it out as, moral injury, giving names to it, wrote an article on KevinMD about gaslighting CEO and the stages of gaslighting. And then I decided I'm going to write about these characters. So I wrote about the narcissist Snakeskin Shoes, who was the former VP of marketing and communications at Children's, who has since gone after I left. But it was really enlightening to learn from Dr. Ramani about on the Navigating Narcissism podcast about the stages of narcissism. And also, it helped me as an advocate give myself a break, that I wasn't able to fix it, the system, nor fix, working with this narcissist, and exactly name what I was going through. So when I wrote the article, published it on KevinMD, I would say that it went viral with physicians. So I've gotten so many reach outs from physicians all over across the country. This is what I'm going through. It breaks my heart, but I really find it heartening that I can help. A lot of these physicians really recognize that this is exactly what you're going through. You're not stuck, and you can decide your next best step, whether it's to stay, whether it's to address the issues, whether it's to fight back, whether it's to leave, and how to move forward. And so at the same time, I'm really disheartened and sad that I believe it's an epidemic in corporate healthcare that even is happening in children's hospitals, unfortunately. We all know it, it's no secret. But I feel like at this point in time in medicine, there is a community of people and physicians like me who have gone through it, who can help.
Take us back to that very first time that you felt you may have been dealing with a narcissist. What was that episode like?
That was the first time I would have recognized it would have been the stage 2 devaluation stage. So the first stage is idealization. So there were meetings, of course, it was a huge deal. So we're in Lincoln. I'm this, beloved, not to be exaggerating, but yeah, I had a lot of community partnerships, relationships. So they want in Lincoln, that's what they wanted. And so they didn't have a footprint here. And so what they wanted was to, kind of capture and capture, teach a kid to fish, my nonprofit, and then kind of use me as marketing. So the idealization stage was this love bombing. That's what physicians are going to experience. We want you to lead this, we believe in you. And, this kind of syrupy praise. And of course we all have ego, and that's great. But at the same time, I had this really powerful vision. I'm like, yeah, let's just get this done.
Yeah.
And then once they get you where they want you, so it's like I had already started the dissolution of my nonprofit, and they had the assets, and they had my team, and I didn't get a contract for 100 days. And he kept saying, by the way, I had no idea that this VP of marketing, snakeskin shoes, I call him in the article, would have any sort of directive over me. We had an attorney who said, you need to clarify where you're going to sit operationally. And so I went to snakeskin shoes about that. And he said, well, why is he still involved? And so I was so fearful that this amazingness wasn't going to happen and that my nonprofit would go away. And, physicians, be ready to walk, by the way, clarify these things at first. So that should have been assigned to me, but it really wasn't until I got into it. I didn't have the contract for 100 days. My attorney had to create it. And he was saying things like, well, it's tricky, you're just different from other physicians. And so I was clued in there, and then bait and switch, the COO is what I call her. She's still there. Said, well, what are you going to do with all your money? When I said, I need to be paid for the 100 days of work. And then she's like, what are you going to do with all your money? So I started being like, wow, this is different. But I really remember thinking, I can separate the center. I'm in the community, and I can fully separate it from what's going on there at the enterprise.
So, when other physicians or when you're dealing with this situation, how can you differentiate whether that narcissism is coming from that person themselves versus whether they have to work through a certain corporate structure that limits in terms of what they can do? So, how can you differentiate the two? Because a lot of these administrative people, they have to work within a corporate structure, and sometimes that can dictate how they behave. So, how do you separate those two?
Well, that's really tricky. In my case, yeah, I had 20 individuals, even from the CEO to the board of directors, who were gaslighting me. I mean, I literally felt like I was going to die. So physicians are good at defining what is the problem in front of us, because we have to do that, with our patients. Otherwise, we're not going to come to a correct diagnosis and treatment. So really take some time to get internal, and as you're on the front end, really define and learn about what is the operational infrastructure and setup. And it depends on what you're advocating for. I think it is really tough, and I got into this. If you're advocating for patient safety and you actually have a situation where that patients aren't saved or the quality of care is suffering, that is going to be really tough to find somebody who's going to support you. I don't want to say that HR isn't supportive, but we all know that HR is there to protect the organization. If you can recognize gaslighting tactics, if you can recognize these stages of narcissism, or idealization, then the devaluation, then the betrayal stage where they're actually degrading and attacking you, and then the fourth stage is the discard, where it's like you're used up, you are going to be a real threat to them, and they're going to get you out. So I would say the most important thing is to recognize if you have a narcissist in front of you, to recognize those stages. And then up front, what is the operational infrastructure? So where do you go? What's the whistleblower policy? Who do you talk to if you have an issue? And I ran into that issue too, where I was. So it was unfixable. I want physicians to know, like, you're not going to fix and solve these people. You're not going to fix and solve these systems. And sometimes you just have to make the decision to leave.
So you mentioned when you wrote and shared your story on KevinMD, you got a lot of feedback from other physicians who are undergoing similar situations. What are some other common scenarios that you've heard physicians face when they're dealing with narcissists at their own workplace?
Well, they're all different and then they're all kind of the same. So the reach outs were, and they're women, men, different ages. There's a lot of diversity in but the experience is due to narcissism, gaslighting, and going through these stages. Okay, so there's some that have been terminated and they were really blindsided by it. But when they tell me their story, I'm not, because I'm like, I would have seen the writing on the wall there. And I wish you would have reached out before that, because they were speaking up on patient safety and they were speaking against maybe a really high level surgeon who is the top earner and revenue generator and has the ears of the board. And I'm like, this is not going to end well for you. You're not going to fix this. And then I've had others reach out to me who have had patients, and this is cases of real moral injury, where they've had patients they've sent into like a sick pregnant woman who's having preeclampsia, and they know that she's at high risk, and she's a patient of color, and she's on Medicaid, and sent into the ER 5 times and pleading with them to work her up, and then they didn't. And so it's a case of misdiagnosis, and she ends up having a stroke and sequela. So it's like this silencing, this not listening. It's just like a nightmare for that physician. And then they are the one to lose privileges at all the hospitals, and her career is totally ruined. Another time, I had a physician reach out to me who's like, thought he was on his last run of his career, excited about this practice, building a practice. He loves his partners, but there's one who has a lot of power, who's the narcissist. He thinks he's a malignant narcissist, and he is, really causing a lot of pain. This physician who reached out to me is someone who spoke up, had the right to vote, and he voted against this narcissistic leader, and he's making it terrible for him. So he's asking me, should I fight back? Should I give him the cold shoulder? Should I leave and let him win? Or should I hire a lawyer? And so he and I are going to be working together, because he asked me to actually coach him. And so I'm glad that he reached out, because he's at the stage where he's kind of recognizing it, how unhealthy it is. But it can be really hard when you're like, wait, this isn't the expectation for how I thought my career was going to be. Because I wrote, I didn't go through that to go through this, because it's absurd. I mean, I was like, this is absurd that I'm a physician and a donor at this level, and I'm going through this with some narcissist who's completely incompetent and knows absolutely nothing about pediatrics.
So you mentioned some scenarios. You talked about some characteristics that may indicate that a physician may be dealing with a narcissist. You briefly alluded to some potential options a physicians then may have in terms of doing the next step. So what would you recommend as the next step after a physician realizes that they're dealing with a narcissist?
Well, my thing is to get internal. So what happens is we are whittling down when we're experiencing this. We don't have the energy to make decisions. We don't have the energy to recognize it. We're showing up, doing a good job, taking care of patients, doing all the work, showing up for the mission. And it seems absurd. So one of the things I would say is to have some sort of a practice where you have self-care, or you're writing, and you are not alone. There are so many of us who have gone through this. So you want to create community with intention, with people who recognize that humanity in you and people who have gone through it. So I'm always open for people to reach out to me, and I can help you and have a phone call. But there's going to be people in your life who you can talk to about it, who you can get maybe more of a perspective on it. And then how are you going to decide? Then you get to decide what you want for your career. That's the main thing, like to know you're not stuck in it, and that these narcissists, they're not going to decide your career. They are not going to be any part of your vision for how you care for patients. and also your life. Because I have a beautiful life. I'm like, why am I going through this in the workplace? This is absurd. I have a beautiful husband. He's a physician too, and he didn't recognize it. I mean, we were both stuck in it. So you're not stuck. You can have a beautiful life and a beautiful career, but you probably are going to have to leave the situation. You're not going to fix or solve it. So some sort of mindfulness practice, connecting, writing down and deciding like what you want, and shoring up your CV too. And then you'll know, like, I also think creating some talking points, creating some boundaries. Don't engage in the gaslighting with them. Don't have meetings alone with these narcissists. I mean, that's like a death sentence for your career there. Try to see if you have some allies or colleagues within your department who are like levels, who are not just enablers and going to stay silent and hope that that doesn't happen to them. So we need more of us physicians within these systems to speak up. And as far people ask me, should you hire an attorney? Because I had an attorney who guided different things like the contract, and they were the ones who directed me to leave. If you do hire an attorney, I would not, I can't give any sort of legal advice. You have to hire somebody who knows how to work with physicians and who really knows the labor practices. So an employment attorney works with physicians. I always think that's a fine step. And I wouldn't share that with your organization at all, or the narcissist that you're working with an attorney, because they'll get you out if you do that.
So sometimes leaving the organization isn't always the easiest thing for a variety of reasons. So how much should you work within that organization if in fact that physician is dealing with a narcissist before you make that decision to leave?
That's such a great question. So for instance, you can create boundaries with a narcissist. So physical, emotional, and verbal boundaries. So narcissists really like to have the power and control over you. So if you're not their supply anymore, if they're not getting anything out of you, it may be as simple literally as creating some bully bands. I coach teens who have been weight bullied a lot. So we create bully bands like on Post-it notes, and just neutral things, kind of non sequiturs. You don't have to be sarcastic. I tend to be that way, but just they're not going to get anything anywhere, and also own your truth, maybe 3 statements. If they're coming at you saying something, they don't control your narrative. So you want to say, that's not true. In fact, here's a factual statement, and we're going to move forward. So first of all, there are those boundaries. And then as far as deciding, I mean, it took me a long time. I was like just racked with whether I should leave. I had so much like sunk cost into this organization, and I was the lead for it. And I was going to conferences, and we were launching these big initiatives that have now been killed. It's really sad. You can decide not to decide. That's a powerful coaching tool. You can decide how you show up. So you want to show up as confident or calm and create a thought, there's nothing going wrong. I always have my back. And so you can decide, like, beforehand, before meetings. I had, or the center went under the CFO. He was this kind of misogynistic guy. He had a meeting with me. He called me an aggressive lady when he went back. I'm a big advocate, passionate advocate for children's health. And so he said, aggressive lady. And I didn't like that because I had met with him alone, and I didn't like the innuendo of it. So he demanded that I have another meeting with him because he didn't feel like I was allowing him to talk, I guess. So I got coached, and I decided to show up calm. And I did the whole time. Calm, I'm calm. And he had his say, and I got through the meeting, and I never had to meet with him again, So you can do that. You can decide not to decide. And I think forward thinking. So like writing down like what you want in your career, and getting your CV together, and maybe even working with a coach. I mean, because that's so powerful. So you can really get internal and decide what you want and what are going to be the next best steps. And so you don't want to wait till they give you like the last straw and where you're like, no, I'm out.
So the scenarios that we talked about is between physician and administration in many cases, but narcissists can also be among physician colleagues as well, right?
Right. hmm That's very true. And I know that that's a big problem. And that's a big problem with everyone who's reached out to me who resonated with my article. And I definitely had within those 20 people a list of there's many physicians. So that can be shocking and very disturbing when that happens. And that feels like that stage 3 of the narcissistic abuse pattern is betrayal. And so you can have betrayal by individuals and you can have institutional betrayal, like what I experienced. That can be really tough, but I think one of the things is if you always show up for your vision, for how you care for your patients, and for the mission, you will never fault yourself. And so you can't fix these other physicians who may be taking part in it. You don't want to get in their lane. It's like when somebody's bullying you, call them out as a bully and let them be who they are. You're not going to fix them. I hope that physicians will step up and understand how abusive this is, and that just because it's not happening to you and maybe you're participating in it against another physician because of fear or scarcity, or they're a threat to you, it's going to come for you eventually. Karma catches up.
We're talking to Karla Lester. She is a pediatrician and a certified life and weight coach. Today's KevinMD article is titled The Epidemic of Narcissistic Abuse in the Medical Field. Karla, tell us some of your take-home messages that you want to leave with the KevinMD audience.
Well, what I wish for physicians is that you have the perspective that I did not have. So that's why I'm speaking up. And I want you to know you're not stuck if you're experiencing narcissistic abuse. I want you to be able to recognize the gaslighting and the 4 stages of abuse and get internal. And you can leave. I give you permission to leave if you need to and move forward with your career. You can create talking points that say, I'm excited about the work that we've done here together. I'm happy about how it's going to move forward. And I'm excited about my next best step. You'll be hearing about it soon.
Karla, once again, thank you so much for coming back on the show and sharing your time and perspective.
Thank you.